So in this question, a 34-year-old female presents to your office with moderate hearing loss that she noticed several months ago. She also complains of a noise in her right ear that is very disturbing. So she has moderate hearing loss. She also complains of a noise in her right ear, tinnitus in right ear, which is very disturbing. Physical exam shows right-sided, so it seems like right side has a problem, right-sided hearing loss, and asymmetric smile. Okay, asymmetric smile, and decreased corneal reflex. So corneal reflex is decreased in her right eye. The patient's condition suggests an intracranial mass located in which of the following locations? Alright, so tinnitus, we know that this is cranial nerve number 8. From the drooping smile, we can say this is cranial number 7. And from the corneal reflex, we know that they're talking about cranial nerve 5. So from this constellation of symptoms, we can say that, which part of the brainstem are they having problem in. So let's draw our brainstem. There is the midbrain, the pons, and the medulla. The midbrain has 3, 4. This has 5, 6, 7, and 8, 9, 10, 11, and 12, roughly, right? Like that, right? So we can predominantly see that 7, 8, and 5 is affected. So this is definitely at the level of pons. Okay, so the question says that he has an intracranial mass. The chances are, I think this patient has a schwannoma, right? And the schwannoma is kind of impinging on the other structures in the pons. Usually schwannoma is at the level of pons, and they impinge on the structure by expanding, right? Now, they're saying the patient's condition suggests an intracranial mass located in which of the following locations? So we have to pick from the options which of the following locations. Choice A says between the medulla and the cerebellar hemispheres. The cerebellar hemispheres in the medulla, that's not the right location. We should be talking about the pontine area. So this is out. Above the diaphragm ocella, no, that's obviously not the right answer. Over the lateral hemispheric fissure, again, it's not even close to the lateral hemisphere. Between the cerebellum and the lateral pons, that sounds good because the cerebellum is right here. Between the cerebellum and the lateral pons, a schwannoma right there on the right side. Sorry, I drew it on the left side. Yes, that seems like a reasonable location. But what about choice E? In the parasagittal aspect of the brain convexity? No. Usually, what do we see in the parasagittal aspect? We see a meningioma. A schwannoma is not obviously there. Between the cerebellar peduncles? Again, that's not the right option. So the answer in this case is going to be choice D, between the cerebellar and the lateral pons. Now let's look at how the different cranial nerves has its effect. So first of all, we're talking about cranial nerve 8, which is responsible for the patient's hearing loss. Cranial nerve 8 is also giving this patient vertigo and nystagmus. They didn't talk about vertigo and nystagmus in this particular question, but we know that cranial nerve 8, if you have cranial nerve 8 disturbance, you're going to have vertigo and nystagmus. By the way, do you know the French for vertigo? It's weird. It's called des vertiges. Anyway, so moving on to cranial nerve 7. Cranial nerve 7 is responsible for that, asymmetric smile. Facial muscle paralysis is caused by cranial nerve 7. There is also going to be anterior sensation loss of the anterior 2/3 of the tongue. So sensation loss in the anterior 2/3 of the tongue is also supplied by the facial nerve. What about cranial nerve 5? I'm going to move it down a little bit so that you can see. Now cranial nerve 5 causes loss of corneal reflex, like in this patient. There is also going to be loss of sensation around the mouth, because cranial nerve 5 supplies the muscles, the facial sensations of the mouth is supplied by the cranial nerve 5. And also paralysis of the muscles of mastication is also supplied by cranial nerve 5. So that is also going to be gone in this particular patient. So anyways, this patient had schwannoma, and the schwannoma resulted this patient to have this constellation of symptoms.